Considering implants or dentures? This decision is bigger than you might think. One option preserves your jawbone. The other can cause it to shrink away, altering your face over time. It's not just your appearance. Your actual sense of taste could be permanently dulled by one of these choices. And we have not even mentioned the hidden health risks, like chronic fungal infections. Over the next few minutes, we will break down the 7 decisive factors you need to know before choosing. So, how do these choices affect you day to day? Let's compare the practical realities of living with each. Implants are cared for like natural teeth, brushing and flossing. Dentures demand a separate routine, daily removal, soaking, and cleaning. With implants, you can eat steak, apples, and nuts with confidence. Dentures often mean avoiding hard or sticky foods. Implants feel and function naturally, allowing for clear speech. Dentures can slip or feel bulky, affecting how you talk. Implants leave your palate uncovered, so you fully taste your food. An upper denture covers the roof of your mouth, which can dull flavors. With these lifestyle benefits, why doesn't everyone get implants? The obvious answer is cost, but is the long-term story that simple? We'll find out. Now, let's address the most significant factor we mentioned at the start. Your bone. Why does one option preserve it while the other harms it? An implant is a titanium post that fuses with your jawbone, a process called osseointegration. This bond mimics a tooth root, stimulating the bone when you chew. Dentures just sit on your gums. The pressure from chewing is not transferred to the bone. Without stimulation, your body thinks the jawbone isn't needed and absorbs it. This effect is substantial. Over years, this resorption leads to a sunken facial appearance, causing dentures to need constant relining as their foundation disappears. Remember the slipping dentures affecting speech and eating? That problem gets progressively worse over time precisely because of this accelerating bone loss. So what if you want implant benefits but have extensive tooth or bone loss? Modern dentistry offers powerful hybrid solutions. One option is an overdenture, a denture that snaps onto a few implants. You get much better stability, preventing slipping and improving chewing power. For a full arch of missing teeth, the all-on-4 technique uses just 4 implants to support an entire permanent bridge, which is less invasive. In extreme cases of upper jawbone loss, surgeons can use zygomatic implants, which anchor to the cheekbones instead of the jaw. But no solution is perfect. You must understand the potential downsides and risks. Let's be clear about what can go wrong. For implants, the main enemy is an infection called peri-implantitis. It is like gum disease for an implant and can lead to its failure if not treated. Your overall health also matters. Conditions like uncontrolled diabetes can interfere with healing. Smoking is another major risk factor for implant failure. Even location in your mouth matters. Implants in the denser bone of the lower jaw tend to have a slightly higher success rate than in the upper jaw. And for dentures, we have to return to the risk of denture stomatitis. This painful fungal infection is common, caused by the appliance trapping moisture. Okay, let's finally answer that money question. Is the cost story as simple as implants are expensive and dentures are cheap? Initially, yes. Implants have a significantly higher upfront cost, but dentures are not a one-time purchase. They come with continuous expenses. Here is where it all connects. Because dentures accelerate bone loss, your jaw changes shape. This means frequent relining and complete replacement every 5-10 years. So, an implant should be seen as a long-term investment in your health. Dentures can become a recurring expense that never solves the underlying problem of bone loss. So let's bring it all together. The 7 key factors are bone health, diet and speech, daily maintenance, taste, lifetime cost, health risks, and modern alternatives. The choice is not just about replacing teeth. It's about preserving your facial structure, your lifestyle, and your long-term health. The best option is deeply personal, depending on your health, budget, and what you value. Now you have a better framework to think through that decision. Your next step is not to decide alone, but to take this knowledge to a qualified dentist. They can assess your specific situation and create a personal plan. Thanks for watching. Subscribe for more in-depth health information that matters.